Encouraging signs as the number of new Covid-19 cases continues to level off, but a warning that we're a long way off the end goal of stamping the virus out. Today there were 67 new cases, bringing the total to 1,106. 13 people are in hospital, 3 are in ICU, 1 in a critical condition. As the country approaches the halfway mark of the lockdown, the Prime Minister has revealed $5.3 billion has been paid to a total of 876,000 workers under the wage subsidy scheme. And she's not ruling out, along with other MPs, taking a pay cut in the future. Director General of Health Dr Ashley Bloomfield says the numbers of Covid-19 cases are tracking as he hoped. But we have to keep going hard and we need to see the numbers dropping. Political reporter Yvette McCullough wraps today's developments.
Dr Bloomfield says we can feel encouraged as the number of new cases each day hovers around the same ballpark.
Especially as it's maintained at that level with the increase in testing. However, I dare say what we really are looking for is a drop in that rate of increase day by day.
He says while we have seen some success so far, we need to see much more if we're going to stamp it out.
And the only way we will get that is if we go just as hard over this next 2.5 weeks in Alert Level 4 and continue the activities that are happening, the actions that all New Zealanders are undertaking to break that chain.
Jacinda Ardern says although these are heartening signs, the country will be seeing out the full lockdown.
All actions we have taken to date are about minimising the amount of time we are at level 4 in order to stamp out the virus. And our actions for the remainder of the period in level 4 will be about doubling down to ensure the gains made in the first half aren't squandered in the second.
Today, major IT groups warned they were being left out of the loop by the government when it came to contact tracing, and they feared the government wasn't moving fast enough. Dr Bloomfield says the ministry is looking at user-based apps, but says there's no point reinventing the wheel and it will be using an already existing one.
There's no shortage of offers and options available. I think if there hasn't been interaction with bodies per se, that does not mean that there hasn't been huge engagement with a whole range of private sector players, including in the digital industry.
The government hopes to finalise its Covid-19 surveillance plan in the next day or so. This morning, Jacinda Ardern seemed to suggest this would include random testing in specific regions, kicking off soon. But Dr Bloomfield was lukewarm on the idea.
Rod Jackson at Auckland estimated you would need to survey at least 100,000 people just to get any idea of prevalence around the community. So still possible we may do widespread testing, but in fact we've seen a big increase in testing over this last week and not a big increase in the cases we're detecting, so that's providing us with a level of reassurance too.
This afternoon, Ms Ardern said work was still being done on this.
Again, what we're trying to do is not just rely on those who are simply presenting, because that's not always producing enough data for us. So again, I'm expecting more detail from the Ministry of Health around what is going to provide that regionalised evidence base that we absolutely need.
Work is still also underway into what position the country would need to be in to come out of lockdown and what post-lockdown life might look like.
We would expect in Alert Level 3, there would be more widespread activity happening, more people back at work, but maintaining those quite strict things around, physical separation, hand hygiene and so on to prevent infection, backed up by really good testing and contact tracing.
Dr Bloomfield says he can't say at this stage whether Level 3 would see things like bars and restaurants reopening. He says whatever happens, the border will be a priority, and moving to quarantining everyone who arrives post-lockdown is an option being considered.
One of the things we'll be actively looking at is what's the posture we need at the border to keep us safe and to stop that growth in imported cases and then potential further transmission.
Debate continues about what should and shouldn't be considered an essential service, with criticism that some fashion retailers are now able to sell items online. But Dr Bloomfield isn't concerned, indulging in some retail therapy himself.
The rationale behind fashion retailers, and I've looked at a couple myself, is because we're coming into winter, it's cooler, and people need to be able to be sure that they've got appropriate clothing to keep warm and keep safe.
Jacinda Ardern says everyone's mental health at this time is a big concern And if people are feeling anxious or scared, that's understandable. She says tomorrow the government will release guidance for how people can manage their worries during this unprecedented time. From Parliament for Checkpoint, Yvette McCullough.
And the Prime Minister also announced today that the Tooth Fairy and Easter Bunny were essential workers, although she did stress in these difficult times that Easter Bunny might not be able to reach everyone.